Please mention in the chat box. So today's topic is occupational health and safety. Those who have the textbook, please mention the page number in the chat box. I don't have the textbook with me. So occupational health, according to WHO, occupational health is an area of work in public health to promote and maintain the highest degree of physical, mental, and social well-being of workers in all occupations. Okay, to make sure that if you are an employee, your employer makes sure that the employee's physical, mental, and social health is looked after. Okay, the occupation or the work is not causing any disbalance in the physical, mental, and social well-being of the workers or the employees. Okay, so the main objectives of occupational health are to maintain and promote the workers' health and working capacity, by improving the working condition and the working environment, and to make it more conducive to the safety and health of the employees. Okay, so these two are the objectives. Third objective is the development of work organization and working cultures that should reflect the essential value of the systems adopted. Whatever values are there in your organization or in the sector that you work in, those values and those principles should be reflected in the work culture. Okay, if they are saying they want a stress free work culture for the employees, that stress freeness should be seen in the work culture. Okay, so the values of the organization should be reflected in the work culture. Employees should have a good health. They should be kept in a good working capacity. Working conditions, the environment in which the people work, okay, that should be conducive. That should be safe and good for health as well. Okay, it should not cause any negative health implications on the workers' well-being. Coming to the healthcare sector, healthcare workers often face a wide range of occupational hazards on job, and these are some of the most common healthcare hazards that uh, in the hospital or the clinical staff suffer from. Okay, so needle stick injuries very common. Okay, among the clinical practitioners, musculoskeletal pain because of long standing hours. Okay, work related illnesses, that is infections, spread of infection, other infections, stress and overwork. Because in India it is very common, because we have a lot of patients, a big chunk of population to be looked after for, and very less amount of staff. Okay, respiratory diseases, very commonly spread and very easily spread among the healthcare workers. So these are the most common healthcare hazards, occupational hazards seen everywhere in the healthcare sector. Coming to the most dangerous part of this, the blood-borne pathogens. Okay, infections transmitted through blood. Even when you contact the infected needles, okay, these pathogenic bacteria or viruses can cause harm to a susceptible host. Okay, and these hosts are mainly healthcare workers. Okay, so hepatitis B virus, HPV virus, hepatitis C virus, and human immunodeficiency virus, HIV virus. These are the three main most dangerous bloodborne pathogens, again a part of occupational health hazard in hospitals. So when it comes to hepatitis B, okay, what can you do when there is an exposure of a staff, okay, of a medical staff to a patient who is dealing with hepatitis B virus? Okay, who's affected with hepatitis B virus? How do you protect, or how do you give a, after getting exposed, okay, after be coming in contact with the hepatitis B case, okay, what can you do to save the health of the and the life of the healthcare worker or anyone in general? Okay, So if the person who came in contact with the hepatitis B patient was unvaccinated, never in their life they took a hepatitis B vaccination. So, and you take their blood sample, you know that they have been exposed to a hepatitis B patient. You take their blood sample, you send it for laboratory to test it, okay, to test if it is positive or negative. So, HBsAg means hepatitis B antigen, okay. If the blood report is hepatitis B antigen positive, which means the virus is there in the blood, okay, the person who was exposed to a hepatitis B case has got infection, okay, they have the antigen. So immediately give the hepatitis B immunoglobulin vaccination, okay. This vaccination is immunoglobulin vaccination. You are not giving the hepatitis B virus here as a vaccination. You are giving an immunoglobulin, you are giving antibody, okay. Now antigen is there in the body, you give antibody injection so that this antibodies will go and attack the antigen, okay. So if the result is positive, give vaccination immediately, and even if the result is negative, still, to be on the safer side, start the vaccination, okay, start the hepatitis B virus vaccination. And if the person who is exposed to a hepatitis B case, if they are a vaccinated person, okay, they have already been vaccinated in their past. If they have been vaccinated in their past, what you have to do is you can start the vaccination. If the hepatitis B antibody already if they have in their body, if it is less than 10 international units per milliliter, only then vaccination is required. Otherwise, if you are in a healthcare industry, okay, you are in a healthcare sector, you go check your blood sample, and in your blood sample, the antibodies, hepatitis B antibodies in your blood sample, if it is more than 10 international units per ml, no treatment is required. You have enough antibodies in your body, specific antibodies of hepatitis B is there in your body, which can take care of you. Okay, even if you are exposed to hepatitis B case, you will be taken care of. The antibodies will take care of you. But if the hepatitis B antibodies is less than 10 international units per ml in your blood, okay, you have antibodies, but it is too less to fight with the antigen. So immediately vaccination is required. If you are positive, if you're antigen positive, start vaccination, start the second round of vaccination, okay. And what do you mean by non-responder? Non-responder is person who is not able to develop the protective surface antibodies after completing two full series of hepatitis vaccine. Okay, there is two series of hepatitis vaccine that you have to take, and one booster dose you have to take. Okay, so after this two series and one booster dose, you still are not developing enough antibodies in your body, okay, to protect you. So you are a non-responder. You are not responding to the hepatitis B vaccination. Okay. So is it clear to all the post-exposure prophylaxis for hepatitis B? Now coming to the post-exposure prophylaxis for HIV. If you are exposed to an HIV patient, okay, either to needle stick injuries or any blood splashes on your body, if you are exposed to an HIV positive case, okay, what you have to do, okay, immediately you have to send your blood sample for test. And if the blood sample comes negative, you are not affected by any HIV virus. You are safe even after needle stick injury. even if it was a superficial injury or a deep wound puncture. Okay, large volume of blood was there or small volume of blood was there, irrespective of that, if your test results are negative, you don't have to take any post exposure prophylaxis for HIV. Only if your test results are positive, be it be asymptomatic or symptomatic, you show the symptoms or you don't show the symptoms, doesn't matter. But if you are HIV positive, you have to take the triple therapy. Triple therapy means three different types of HIV antiretroviral drugs will be given. Combination. It is a combination of three different types of antiretroviral drugs. Okay. Triple therapy has to be taken irrespective of you being symptomatic or asymptomatic. Okay. Usually when your viral load, if it is less than 1500 copies per ml in your blood, okay, that means you are asymptomatic. And if you have high viral load, means there are too many copies of virus, HIV virus in your bloodstream, more than 1500 or to more than 2500 copies per ml, that is the viral load in your bloodstream. Okay, you may be suffering from AIDS already because it is symptomatic, so you will be continuing the triple therapy, the combination of three antiretroviral drugs. Different combinations of these drugs are given in the textbook. That is for your self study. Pregnant women, they have a different combination. If a pregnant woman is affected with HIV, a different kind of a combination of drugs is given, antiviral drugs is given. So just read through the points. But post exposure prophylaxis, this is what you have to take care of 24/7 at any time of the day. Whenever you get a needle stick injury, make sure that needle, if you can procure, keep it aside. Send the needle to test in the lab as well. Send your blood sample to test in the lab. Go to the emergency department of your hospital and get the post exposure prophylaxis done. Okay, PEP for all the infective diseases, communicable diseases, is always present in the emergency department. Is it clear to all? The different names of the medications and all the guidelines to follow up with the medications, that is self study, you can just go through it, read through it once. Okay. Then post exposure prophylaxis for other communicable diseases like measles, varicella, that is chickenpox, tuberculosis, meningococcal meningitis. So if you suffer from measles, okay, you have been exposed to a person who is suffering from measles, within 72 hours after you being exposed, take the vaccination. And if you have missed this 72 hours window period, okay, if it is too late for you to realize that the person had measles, after 3 days you got to know, you can go and take directly the immunoglobulin within the 6 days. Okay, especially for a high risk person. Okay, if you miss the first 3 days window period, on the fourth or fifth or sixth day, you can take the direct immunoglobulin. Vaccine means live attenuated virus is given. Okay, immunoglobulin means direct antibodies are injected inside you. Okay, coming to varicella vaccine, but the varicella infection, you have been exposed to a chickenpox case, etc. Within 120 hours, vaccination can be taken because the varicella zoster incubation period is quite long. Okay, so within 120 hours, you can take the vaccination after exposure, or within 96 hours, you can take within the or almost around the same time, you can directly take the antibodies for a high risk patient. Coming to tuberculosis, all cases of positive tuberculosis, whenever the acid fast bacilli test or the Mantox test has been positive, immediately report to the infection control practitioner. You will be guided to the nearest dot center, either inside your hospital or the nearest dot center. And depending upon the hospital protocols, you will have to take the DOTS therapy. Okay. Then meningococcal meningitis. Simple, this is chemoprophylaxis, that is antibiotic. Ciprofloxacin is given. This is the antibiotic that works for meningococcal meningitis. Coming to the next topic, needle stick injury. Needle stick injuries are wounds caused by needles that accidentally puncture your skin. And this accident puncture can take place in the following occasions. Majority of it happens when you are inserting an IV cannula. So nurses are at high risk. Second is when a biomedical waste handler is handling a garbage bag, a needle garbage bag, okay, or a sharps garbage bag, 21% of cases. Then during dusting through blood sugar needles, the housekeeping staff is at risk. People who are using uh, uh, insulin medications at home, insulin syringes are being used at home. Okay, at home, whoever is a family member who is doing the housekeeping and all, they are also at risk, okay, of getting stuck with blood sugar needles. Then handling suture needles, that is by surgeons, okay, subcutaneous injections again by nurses. While recapping, never we should recap, okay, but some people they still do recap the needles, okay, they are also at high risk. Then withdrawal of blood, while blood withdrawal, so lab technicians, okay, they're also at risk of developing of getting needle stick injuries. So needle stick injuries among healthcare workers, you can see here nurses are at the highest risk of needle stick injuries. Then your senior doctors, junior doctors, student nurses, okay, dentists, dental staff, very rarely dental staffs are at risk. And other staffs, these are the housekeeping staffs, biomedical waste handlers, they come under the 19%. Okay, nurses and the biomedical staff, waste handlers, they are at the highest risk of getting needle stick injuries. So what are the key recommendations of safeguarding your staff from needle stick injury? One needle, one syringe, only one time. Never reuse the needle or syringe for anyone. Okay, that is the bottom line. Follow proper infection control practice, aseptic technique during the preparation and administration of medications. Even while administering medication, follow asepsis. Okay, that is the SOP you have to follow. Perform hand hygiene, then follow asepsis, administer the medication, come back again, uh, discard the needle properly. Don't recap. Discard the needle immediately, and then do the hand washing and record the procedure. Okay. Uh, Never administer medications from the same syringe to more than one patient. Even if the needle is changed, doesn't matter. Some public hospitals they still do that to safeguard the inventory. They work on very low inventory. Okay, they are also their hands are also tied. They work on very low inventory to make sure they save as much as possible the syringes. Okay, they use the same syringe. They may change the needle. In some cases they will just flush the needle using distilled water and take in the medication again and give it to the patient. Okay, so these things are also done in many hospitals. Okay, so even if the needle is changed, doesn't matter, you have to discard the syringe as well. Never enter a vial with a used syringe or a needle. Okay, always make sure, because once the needle has been used, or once the needle has poked into like once the needle has poked into a vial, a rubber sheet, or a patient's body as well, if you see microscopically, the needle's structure has changed. It will cause more trauma to the patient. Okay, it will cause more traumatic injury if it is a needle stick injury. So once a needle, if it is stuck and pulled out, it should never be used. Do not use medications packed as single dose or single use for more than one patient. Okay, nowadays a lot of medications come in single dose and single use to prevent infections, to prevent contamination and transmission of infection. But some hospitals, again, to save their inventory, They will use the single dose medication for two patients or more than one patient, or for the same patient again they will use it. Okay, so don't do such practices. Do not use bags of intravenous solution as a common source supply for more than one patient. That is IV bottle. When you give for one patient, don't use the IV bottle, or don't take the fluid from the IV bottle and give it to other patients. One. So using a common IV bottle or common saline water or common DNS solution and spreading it, and using it for different patients. Okay, taking the same IV bottle or IV solution, poking different needles into this bottle and using it for different patients. This is also unhygienic. Limit the use of multi-dose vials, and if you don't have any other option, you have to use multi-dose vials. Dedicate one multi-dose vial to one patient. Okay, don't use multi-dose vials for multiple patients. That is, in one vial you can give at least 5 to 6 injections. Okay, that is a multi-dose vial. So make sure you give that 5 to 6 injection from the same multi-dose vial to one patient only. Okay, so you will prevent the spread of infection. If you use multi-dose vial for multiple patients, you are coming back to the same vial to retract medication and give it to a new patient every time. So the risk of transmission of infection is high. Always use face masks while injecting material or inserting catheter into the epidural or subdural space for in anesthesia before the surgery and all. Especially you have to take care of this point. Face mask has to be used, cover your face and shield. Yes, it is contagious. It can be contagious. Post needle stick injury procedures. After a needle stick injury has taken place, what can you do? Stop the procedure immediately. Okay, and go and wash your wound with soap and water and encourage bleeding. Apply aseptic solution as well. Okay, immediately has to be done. If your patient is in any distress, call a nurse or call any of your colleague to take care of the patient. Okay, and then you can encourage the bleeding and continue your care, your wound care. Okay, and you can apply the aseptic solutions as well. Immediately report it to the nodal officer, the casualty, or even at first aid. Okay, and emergency treatment, or follow any other actions as well. PEP, that is post exposure prophylaxis, is always provided in the casualty 24/7. It is available in the casualty. Rush to the casualty immediately. Retain the items that have caused you injury if possible. Don't throw it away. Whatever needle, blade, scalpel, that anything, or even shredded glass that has caused you an injury, don't throw it away. Retain it. Send it to lab for test as well. Investigate, determine, and implement the remedial measures. So you have to wait for the lab reports, wait for it if it is positive or negative, and based on that, investigation has to be done. Uh, find out you need PEP or not for which particular condition, which particular infection, and you have to move forward with that. Record and document each and every needle stick injury. It will be used in the hospital infection control committee meetings, these datas. So that's all about needle stick injuries and occupational health and safety.